Question number 2 in this series is, can I avoid the surgery? Is there anything I can possibly do to either give myself more time or avoid the surgery completely? And this would be a great question for your physical therapist. If you haven't seen a physical therapist before your total knee replacement, I would highly encourage you to do so. A skilled physical therapist would be able to help you navigate the medical system. They would help you ensure that you've tried all conservative measures to avoid having this surgery, because oftentimes there are things that will buy you more time, that will relieve some of the pain, improve some of the function. And if they can't put the surgery off a couple months, a couple years, the physical therapist will tell you. The greatest value the physical therapist has is that therapist has probably worked with several hundred individuals who have had knee replacements, and that therapist has seen all different kinds of outcomes. So take the time before surgery, schedule an initial evaluation with a licensed physical therapist and talk about your concerns. Talk about if there's any opportunity for you to push the surgery back, give yourself a little more time, and what you can do in the meantime to prepare for the best possible outcome after surgery.